Hello, I'm Lisa. Some of you guys are following me already on Twitter and Facebook. I have a page called Stand Up, and it is to advocate for people to be treated as patients and not to lose access to medication that we need to treat pain. Over the last several years, people that need pain medication have been treated very poorly. We have been treated like the scum of the earth, basically. And it really bothers me because I'm a patient, for one, and two, because I'm a nurse, and I can't believe what's going on as far as the way that we are being treated. I can't believe the way that it's not legal to prescribe medication or change dosage on medication unless you're a doctor. And basically that's what's going on now. Politicians are saying, you can't prescribe any more than this and so. You can't prescribe any more than this amount of medication to your patient. And it's insane. I never thought that I would see this day come, but it's here. And we've got to do something about it. And the more that we talk and the more that we speak and stand up for ourselves and for our rights as patients, the more we'll start to see some results. And I do think that we can turn this thing around. I don't think it's going to be overnight because it didn't get here overnight. But I think that just doing what we've been doing, whether it's just Twitter, Facebook, whatever it is, to let your voice be heard. I know some people cannot get up. Some people are bed-bound, wheelchair-bound. But if you have access to the internet, through smartphone, whatever source you have, your voice is important. Don't think it's not. Don't ever think, well, I can't do anything to fight this because I can't walk, or I can't rally, or I can't, just don't think that. Don't think that you are no good to the cause, because you are. You are. And you're here for a reason. Please don't give up. We've had several people commit suicide because of pain medication being taken away from them and losing hope. And it's disgusting. And I just want to say, as a nurse, that my 30 years of my life was spent trying to take care of people that were sick, suffering, and to relieve their pain, to relieve their suffering. And now that I can't work anymore, I feel like that I still can do something to help people. I can still, because there's a need to advocate. And I feel like that what I have to say is just as important as what Prop had to say. What Andrew Kolodny, I don't know how to pronounce his name. I'm going to go ahead and say that. I don't know how to pronounce his name. Some people pronounce it colostomy bag, and I would say that pretty much is on point. I'm not a mean person, and I don't like to be mean to anybody, but this man is just, I just cannot say. I have no words. Some of his interviews, I cannot believe that people actually take this man serious. Not only do they take him serious, but they say that he is an expert, he's a scientist. What? I'm going to give you some examples here. I'm going to read this. I'm going to read this interview, and it was talking about the story was that they're about how we as pain patients are being affected in a negative way by the cutbacks. And so he had to put his 2 cents worth in. And it says, I'm just going to read the part of the article that it talks about whether or not our pain medication is needed. As for the benefits of long-term opiate therapy, the evidence is scarce. Okay, the evidence is scarce. That doesn't mean it's not there. So since you have no evidence that our medication doesn't work, then you have no evidence. In other words, what's been put out in the media is that there is no evidence that says that treating pain, chronic pain with opiates is effective. Well, there is no evidence that says it's not. As this says, the evidence is scarce. The CDC says few studies have rigorously assessed the benefits of the drugs for pain lasting longer than 3 months. Some of us have pain that's going to last us the rest of our lives, and we know that. And there's nothing that we can do about it. If it was, we would gladly do it. We would gladly do it if there was. So the CDC has few studies on assessing the benefits of opiates for pain lasting longer than 3 months. Most randomized clinical trials the CDC reviewed lasted less than 12 weeks. Clearly more research is needed. In the meantime, CDC says the urgency of the crisis required action. Okay. So there was no evidence that this did not help us. But the urgency of the crisis required action. Okay. But if the evidence doesn't support opiate treatment for long-term pain, why are so many chronic pain patients convinced they need the drugs to function? Well, don't you know Mr. Kolodny's got an answer for that. Andrew Kolodny, an influential substance abuse expert and one of the country's most vocal critics of opiate overprescribing, thinks he has a pretty good answer. Let's just see what that answer is. Mr. Kolodny says those patients that he sees are probably dependent on the drugs and may be addicted. The language that they'll use to describe how they think opiates are helping them is the exact same language my heroin-using patients use, Kolodny told me. I've been treating opiate addiction for about 15 years. They use the same exact language. Doc, imagine what it feels like every morning, feeling like you've been hit in the chest with a baseball bat until you take your first dose. Well, I've never told my doctor that because I don't feel that way. But I do appreciate Mr. Kolodny just saying that if we say that our medicine helps us, that we're just saying what any addict would say, that we're not really benefiting from our medication, that we're just addicted. So what he just said in this interview, and this statement that he just made, is that none of us that are being treated for pain have any credibility whatsoever. We have no credibility that when we say this medicine helps us, we're just talking like a heroin addict. Bottom line. I cannot tell you how mad this man makes me. Well, there's no need for me to be angry about it, because that's not doing any good. I'm ready to take some action, and I'm ready to, I'm a firm believer that things like this are going to have to turn around. In Kolodny's view, these patients are feeling better from opiates, not because the medication is treating an underlying pain problem, but because it's treating their withdrawal pain. And his view holds a lot of sway. Why? Why does his view hold so much sway? Why does his view hold so much sway when he's never met me, and he's never met you, and he's never met any of the other millions of people that hurt every day? Why does his opinion carry so much sway? Who is he? He's not the first person I worked in a treatment center. I worked in a detox hospital. I've worked with heroin addicts too. Does my opinion carry any sway? In Kolodny's view, these patients are feeling better from opiates not because of the medication treating pain, but it's taking care of their withdrawals. He is the co-founder of an advocacy group called PROP, or Physicians for Responsible Opiate Prescribing, even though the majority of the people on the board are not physicians, just so you know, because I've already researched it and pulled them up, and the majority are not physicians. I think I'm not even going to go there. He's a committee member of the Fed Up Coalition, which wants the federal government to commit more money to addiction treatment. He was also a member of the stakeholder review group that offered input to the CDC as it was crafting its guidelines. Oh, yes, he was. Absolutely, he was. So, he holds no credibility. Pain patients hold no credibility with him. Another interview that he gave. Question. There has been much written in scientific literature in the media about pain and pain management over the last decade. Yet we still appear to lack an effective toolkit for treating the range of pain problems that affect people. Why do you think that is? Well, his answer is this. I don't believe we're lacking an effective toolkit for treating pain. There are many treatments for pain that are effective. Well, what are they? What are they? Where are they at? Because like I said,